Hi, I'm Dr. Leila, a California board certified family and cosmetic dentist and the proud owner of Leila Hariri Clinic in Dubai. I graduated from UCSF, one of the top 5 dental schools in the world, and bring over 25 years of experience, 21 of them right here in Dubai. I've been honored with the I Love My Dentist award twice, thanks to the trust and connection I share with my patients. My mission is to transform smiles, build lasting relationships, and make dental care something you can feel confident about. Join me as I share expert advice, stories, and insights to help you achieve the healthy, beautiful smile you deserve. Today, I'm thrilled to welcome a special guest to our podcast, Dr. Sammy Mossa. Dr. Sammy Mossa is an exceptional dentist right here in LH that practices exceptional patient care. We'll be talking about his journey into dentistry, what excites him about modern dental techniques, and the philosophy he follows in treating his patients. So let's dive right in. Welcome, Dr. Sammy, to our podcast.
Thank you.
Dr. Sammy, can you give us a little bit about your background and what brought you to Dubai and to becoming a dentist?
I do get asked this question very often, actually. In my youth, I wanted to be an engineer, and we have a trend in the family of focusing on the medical field. A lot of my family members are doctors, so I thought of dentistry because it combines the best of both. We are engineers, we approach the mouth trying to engineer solutions for problems. And in the same times, we're doctors treating our patients and taking care of them.
Absolutely.
I attended Loma Linda University and graduated in 2010, earning an award for clinical excellence. Then I worked in Chicago before I came back to Canada, where I worked in Toronto. And then I moved to Edmonton, where I stayed for the last 15 years of my life.
Wow.
Basically, what brought me to Dubai is a mix of a bold sense for adventure mixed with family reasons.
Beautiful.
Dubai, I find, has a lot to offer. The food is great, the weather is great, and it's very safe. And it's amazing how you see people from all over the
walks of
world.
life. Yes.
It's a very diverse and international place to be.
Absolutely. And what excites you about dentistry today compared to when you first graduated?
Uh, when I first graduated, dentistry was in its classic form, starting to become digital. My focus was mainly on the bread and butter of dentistry. Then the digital aspect in dentistry started to kick in. Now I find that dentistry is more focused on AI. There is a lot of tools in AI that can help us diagnose, can help us design a smile, for example, or a reconstruction of the mouth, and can help us find out if there is any issue or disease or any problem, so we can tailor a treatment plan to help our.
Absolutely. No, we've jumped with medicine and dentistry quite a lot, especially recently. I think these recent years have been the biggest jump ever in history. So quite exciting times ahead.
I think that sums it up.
Yeah. And here in our clinic, actually, we're in the process of introducing AI. And the first aspect in the clinic will be in diagnostics, which is actually it's called second opinion. I'm so excited about this because patients right here in this room will get a second opinion and we get to check ourselves as to our diagnosis. And of course, the human touch is always different. So we have to still look at that. But yeah, I think the two together will be amazing.
Excellent. Yeah.
So, one thing that makes a great dentist is not just skills, and we know that it's a connection with patients. Can you share your approach to patient care and how do you ensure that each patient feels comfortable and at ease?
Basically, when the patient first comes to see me, I have to establish trust with the patient and I have to listen to them. Listening is a very important part of the experience. I will sit with them, listen to their problems, and what is bothering them. And then we will diagnose to the best way possible to make sure we have all the information we need. And then we can create a treatment plan for them. I know there was a lot of stigma associated with dentistry in the past, pain and discomfort. Dentistry nowadays is very different than what it used to be in the past. We have a lot of tools and equipment that can help us make it a stress-free experience with zero pain.
Correct, correct. The the thing that people think that they equate dentistry to pain always hurts me, because it shouldn't be that way. If dentistry is done correctly, there shouldn't be any, I don't want to say any pain, but really, I don't like the two to be equated with each other. And number two, on the note of listening, I had a professor in dental school that said, your success will come if you listen to your patients
Very
and
true.
listen to their needs. And that has stuck with me. So really, I try my best with every patient to first ask, how can I help? And listen in depth, not just superficial, because they could be saying something much deeper than what they're actually saying too. And we have to pick up on that. And then, as you mentioned, the treatment plan, it's very important to be really, how do you call it, upfront and give them all the options, what we recommend the best option, but yet all the options and priorities. Not everything has to be done. And so all of this absolutely leads to amazing patient care. Now, do you have any stories that bring, that come to your mind about the comfort that you have given to patients over the years?
I think we all have stories, including you, doctor,
Yes.
as well. I mean, that's what's beautiful about dentistry, because in dentistry we do change lives in small amounts sometimes, and in big amounts sometimes. I mean, I have so many examples here. I can remember, like maybe 10 years ago, it was Christmas in Edmonton, and there was this young, beautiful girl. She walked into the office and her teeth were in a bad shape. She could not smile. She would be hiding her smile with her hand. And she was desperate. She wanted someone to help. She didn't have a lot of money on her. And at that time, I felt, okay, it's the season. We have to do something for this person. So I spoke with the manager. We decided to do a one-time exception. I spent almost 4 hours on this patient. I did remove all the decay on her front teeth. We put some cosmetic fillings on her teeth, and we completely changed her smile.
Amazing. That is amazing. My son was actually associated with something like this. So it was basically charity, right?
She paid what she had.
Okay.
I mean, it wasn't free completely, but we did, I mean, what we did for her was way beyond
Transformative.
her budget.
Of course. Absolutely. Absolutely. And those are the changes that we can make that really bring value to our lives.
Totally.
It's
I mean, she was happy, but I'll be honest with you, I was happier than she was.
exactly. That's the point, is what really brings us joy is helping others, not as dentists, humanity. I'm talking about human to human, is giving, not
Giving,
receiving.
exactly, with the pleasure in sharing or giving someone else or improving their lives. This is it has a different
It's a
taste.
different ballgame
It's a different
altogether.
situation. Yes,
True,
totally.
true. Back to AI. What is at least one of the AI tools that you work with every day that has really transformed your life and maybe perhaps your patients?
AI is still new in dentistry, but it's very promising, I have to say. The main focus of AI right now is on diagnosis, proper diagnosis. Like, we can process an X-ray with AI, and we can detect things that perhaps we could possibly miss especially in early stages.
Correct.
When there is a cavity in early stages, sometimes we miss it.
Correct.
And it's better to treat a small problem rather than treating a bigger problem
Absolutely.
or a more
Less
expensive
chair
problem.
time and less money.
Exactly. And also when the patient sees it in front of the screen, they understand the extent of what's happening and they are more motivated to help themselves and decide to do the treatment. Another aspect of AI that is also still in early stages is the design. The design was still organic, and to some extent, there is a human element in it. AI is learning from humans, and that accumulated knowledge from humans is being embedded into AI to create an even better outcome.
That's what I'm looking forward to having a robot that can have more precision than a human could. Because
Totally.
we know as humans, it's inevitable. You are not the same person every day that you wake up, as much as we try to be, but we're not. So a lot of it depends on how we are that day. So if we have a robotic hand side to side by side with us, knowing that that precision will be there, 10 notches, tenfold, 100, a million, whatever, I find that so exciting. I think that is
100%.
really the next.
I'm excited too.
Yeah, that is the next revolution. And in terms of technology, any advancements that you think that has really helped us?
I mean, we already have intraoral scanners that
Yeah.
can take 3D images of the teeth and the mouth. They can help us a lot in diagnosing and creating smiles and also creating reconstructions as well. We have 3D images, 3D x-rays that can help us visualize a surgery before we do it. We can also print surgical guides that can help us position our implants in the most ideal position, especially when the case is complex.
Absolutely.
I have to say one thing. At the end of the day, it's really about who controls these tools and equipments, because it's not the guitar, it's the guitar player.
Absolutely. Absolutely. Very key point. Now let's change the subject and do something fun. What's one thing that you would say to the audience that your patients don't know about you?
Okay. Well, some personal information. I'm a cat person. I love cats. I find them to be very peaceful and adorable creatures. I also I used to play the guitar, and now I don't, because I don't want to create public embarrassment for myself. I consider myself more like a guitar technician rather than a guitar player. I have my own customized guitar which I built myself. Also, I like ice cream. I like working on my car as well. Yeah,
That
that's
engineer,
among the
that
things.
engineer
Yeah, the
within
engineer part
you.
of me. That's
Yeah.
what's kicking in, I would say.
It's always there.
Mhm.
And if you weren't a dentist, what would you be?
Okay. I believe in something. I believe that if you're a dentist, you can do anything. I truly believe in that. If you can do dentistry, you can do anything. But if you ask me specifically what I would do if I wasn't a dentist, I would probably follow in my father's footsteps, becoming a general surgeon or maybe a plastic surgeon. I think that would satisfy me as
Amazing.
a human being.
Thank you so much. And any last inspiring words to our audience?
I mean, I have to say one thing to patients in general: prevention. Take care of yourself. And if you have any signs or symptoms, don't ignore it. Help us help you take care of yourself. And don't be afraid. We have tools and equipments that can make your experience much better than what it used to be in the past.
Thank you for that. They've heard me say a lot about prevention in the past.
Totally.
And I will continue to say it. Yes.
Now, for the young people or young dentists, young people who are interested in dentistry.
Aspiring dentists,
Totally.
yes.
I mean, if you have a passion for what you do, you don't have to work for the rest of your life. And don't be afraid. Have dreams and pursue them. And the universe, one way or another, will help you.
Absolutely. I attest to that completely.
Mhm.
Very nice words of wisdom. Thank you so much, Dr. Sammy, to
You're
being on our
welcome.
show
Thank you
today.
again for having me in your
It
clinic
was
and practice.
a pleasure.
Thank you.
And to book an appointment with Dr. Sammy or any of our amazing doctors here, please visit our website and do subscribe to our podcast. And until next time, stay safe and keep on smiling, everybody.